us or folks. So our goal is to make zero work for families and providers in that transition, but also to continue to work with all of you and to listen to all of you on how all of the programs under DELC, what our opportunity to really make them work better, both for families and for providers and for children.
Great. So this slide is just a little bit of more info on why DELC is becoming its own agency, what it's sort of pulling in: the Early Learning Division, the Office of Child Care, Employment-Related Daycare, DPU, and Inclusive Partners. In fact, Inclusive Partners has actually already come back over to ELD. It used to be at ODHS, and it migrated last summer. And to sort of re-emphasize David's point, the strategic priorities that we're really driving towards are making sure that families have the appropriate level of access to services, supports, and information, that the workforce in childcare and early learning is well supported and has the career and technical and professional development pathways it needs, and to really be able to sustainably operate and coordinate the early learning system and the childcare systems that are throughout the state. So that's a little bit about DELC and why ERDC is moving to DELC on July 1st. Does anyone have any questions about sort of DELC coming to fruition, becoming its own agency, what that means for the state of Oregon? Jordan, anything in the chat? Nope. Okay. No. With that, we're going to move on to our bread and butter, which is, what is the ERDC program generally? And I'm going to pass it over to Jordan.
Thank you, Kayla. What is the Employment-Related Daycare Program? Well, hopefully many of you are already well familiar, but some of you might not be. You might already just have connections to the Early Learning Division in other programmatic ways. Or you might have an intimate knowledge as a childcare provider, a parent, family member, or even an employee of one of the respective agencies involved. Employment-Related Daycare, or otherwise known as ERDC, is Oregon's primary childcare assistance program. So essentially, ERDC helps many eligible families pay for their childcare costs by making those payments directly to their childcare provider. We'll get into kind of how that happens in the future and kind of what that will look like future state as well. Currently, families pay a small copay to their provider directly, and the state pays a set rate to their provider for the number of hours the child was scheduled to be in care for that month. That's sort of like a high-level view of how the program works. Families can use a provider that's already listed and approved with the direct pay unit, but they also can have, a friend or family member, or if they know a program that's licensed but they're not yet listed, that friend, family member, or facility can become listed with the direct pay unit to receive payment, with an emphasis on parental choice and access to childcare. The program, which is to say ERDC, is largely federally funded through the Child Care Development Fund. There's some fun laws there for you to check out if you're interested. The 45 CFR Part 98, it's quite fun. CFR establishes a baseline eligibility criteria for states, things like age, income limits, work requirements, and then it also sets standards on how states are to distribute those payments and how they need to establish provider rate and family copayment structures. States have some flexibility within those structures that are set by CFR or by the federal, the Child Care Development Fund. It's funded through both federal and state general fund as well. So we have here the biennial budget for 2021 to 2023, which is a little over $300 million, including ARPA funds. At this point, it looks like we're scheduled to spend down approximately 76% of that, or $233 million for this biennium. And then the program exists within what's called or referred to as a budget box. And that really just means that there's a limit to the amount of families that can be served on the program at any one time, based on the cost per case and the total available budget. That's kind of a a lot of information. Are there any questions around that?
Jordan, I did just want to maybe modify one tiny piece of that, which is at this point in the year, we're looking at about 76% spend down. That's not for what the entire year projection would be. We're closer to, spending almost everything that was appropriated for the 21-23 session. But, that number is specific to the point in the biennium that we're at.
So can I ask a question? What would happen right now if, let's say we're 3/4 through the session and it was looking like we had spent 4/5 of the funds? There was sort of a prompt around the wait lists and when those happen.
Yes. I just always find it fun to field within your own team. Jordan, I don't want to scare anybody, which is why I just want to be careful. We're not anticipating having to go to a wait list or a reservation list, as I think it's a little bit more formally known. But Jordan, do you want to talk a little bit about that process and how it would work in the context of the budget box, right?
Yeah, absolutely. So whenever we get to a point where we're close to the confines of said budget box, or we've kind of reached the limit to the amount of families that can be served on the program at any one point, there is the possibility of what has traditionally been called a reservation list. But really we've been calling it a wait list because it's a little bit less of a reservation and more of kind of a waiting period for families to be able to apply. Essentially, it puts the program on hold for most families. There are some exceptions to that, such as those who've received TANF within the last 3 months. That's one very large population. Foster families is another. So there are families that can bypass that reservation or waitlist process. But essentially what it does is families submit their information. There is a poll. I believe it is now a randomized poll, but that's where I'm not entirely sure. So I would actually leave that to my ODHS colleagues to answer. But essentially those families are then contacted to apply as budget is available. So as slots are available to approve families, that is sort of the process for what happens for the wait list. We haven't had one in place since 2018, so that might be something that is hopefully a comfort to those on the call, but that is sort of what would happen should that occur.
Yeah, so just want to reiterate, I think David's question is extraordinarily helpful from a sort of hypothetical, where would we have to be if we're seeing that sort of current state. We are, our actual expenditures are a little bit behind where we think we might be. So we're certainly not we're over where we anticipated for our budget. So just want to make that pretty plain from like a current state today perspective. I also saw a question in the chat about how many families are being served to how many we think may need assistance. I think this is a great segue to our next slide, Jordan, where maybe we could talk a little bit about who does ERDC serve now?
Yeah, absolutely. Okay, so who does ERDC serve? The program serves over 17,000 children statewide, over 9,000 families statewide, over 3,000 childcare providers. Those are listed childcare providers with the direct pay unit. And then there are some statistics here around the average cost per case and average copay per family. So the average cost per case currently is $1,538 per month. That is a little higher than what we've shared in the past, and that is because we're presenting out on actively connected cases. And what that means is that these are families that have a child care provider who is listed with the direct pay unit, and they're receiving a billing form every month and receiving payment on that family's behalf. So we do have a lower cost per case that represents those families that aren't yet connected to a childcare provider, and that is $1,352 per month. And that is for over 10,000 families. So there's about 1,000 families that are unconnected to providers for whatever reason, whether they haven't been able to locate a childcare provider yet, whether their provider is going through the childcare provider listing process, et cetera. So that's sort of a differentiation we wanted to make when we were going through this presentation. Additionally, we have here the average copay per family is currently around $14.51 per month. That is another thing we wanted to kind of call out, because in the past, that average copay has been far higher. Last October, so October 2021, we were able to make some very large expansions to how copays were structured for families. Previously, a lot of times that was up in the triple digits for families, and now we really have lower, more affordable copay amounts for families when they apply and throughout their certification period.
And I think Chris added in the chat, I think what I was also just going to throw in, but I'll say it verbally to make sure everyone hears it. The estimates are that we're currently serving about 16% of the families that meet all of the criteria to be eligible for enrolling in employment-related daycare. So that means that if every single family that showed up that met those eligibility criteria and said that they wanted to be part of employment-related daycare, that would be much bigger than our budget box, right? So we don't have, we're under our budget box. So currently anyone who wants to sign up is able to sign up. But if all of those families that are currently eligible did show up, there would not be the funding to support all of those families.
Thank you, David. This slide here, we talk about which families might be eligible for ERDC. So this is kind of a high level view, but eligible families, when they apply, have to have beneath 200% of the federal poverty level at application. We wanted to call out here as well, though, that during their certification, so once a family is approved, and then also at recertification, they can earn up to an ongoing and exit income limit, which is either 250% of the federal poverty level or 85% of the state median income. And that is calculated, whichever one is higher for that family is what we would look at as that highest income limit based on their income and based on their family size. Eligible families also must make sure that their chosen provider is already listed or is becoming listed through the direct pay unit. And that's because payments can only be made to listed providers. So while that isn't an eligibility barrier to keep families from becoming approved, the actual payment and delivery of those benefits is contingent upon their provider becoming approved. And again, we'll talk more about that later in the presentation as well regarding the provider listing process. Eligible families must either be working or in school or both. This is an area that has been expanded as of January of this year, actually, and we're very excited to share out on that, that now we do support students who are working and those who are not. And in the past, that used to be a criteria for students was that they had to also be employed. And then lastly, eligible families with children in need of care must meet immigration and citizenship requirements. And you can see here there's a little star there because that is something that through House Bill 3073 that Kayla touched on earlier will be changing in the future. We just don't have quite all the details figured out on it yet, but we're working toward that. And there's more information at a link there that I'll go ahead and share in the chat. Okay. Recent and future ERDC policy changes or eligibility changes. We've already talked at length about House Bill 3073 and how it's expanding ERDC eligibility. And there are changes that have already gone into effect in January, as well as there are future changes that will be occurring. So on January 1st, as I already mentioned, we began serving students who are not working. And we also made some really exciting improvements to childcare hours for many families and how childcare hours are approved. So as of January 1st, as you can see here, We have the part-time and full-time authorization for families, and that really means that families who are participating in ERDC are able to receive more childcare hours per month because they're automatically rolled up to either a part-time or full-time allocation of hours. So hours will still be added for travel time and for caretakers who need more than full-time childcare. But that is one area that we're very excited about in expanding access for families. Additionally, we've already touched on student eligibility, but in addition to non-working students, we're also able to help support teen parents. Previously, we've had teen parent contracts that have been operated through ODHS, but ERDC is now able to serve teen parents as well in all areas of the state, besides just the areas that those contracts are working within. For students of higher education, study time is also being added on. You can see here that students get 5 to 10 additional childcare hours per week for study time, depending on the number of credits they're taking, whether they qualify as a part-time or full-time student. And then sleep time, families with 2 caretakers can now get sleep time when a caretaker works a night shift. That is very, very exciting as well. Lastly, for the January 1 changes that we've talked about a little bit, is that caretakers are now able to receive what's called authorized medical leave when they're on leave for either the birth of a child, caring for a sick child, or caring for a sick child, as well as their own medical leave needs as well. Sorry, I got kind of turned around there for a second, but one other exciting advancement that's been made though for January 1st is that applicants can actually receive ERDC even when they're on medical leave when they first apply. And that is a very large expansion that didn't used to exist. It used to be only able to be approved for families who already had existing ERDC benefits. And so those families that were on medical leave when they first applied weren't able to be eligible.
Jordan, before we go into anticipated future changes, some questions in the chat. Do working students have to be 18 years old?
Working students, no, because we have a teen parent population. So no, they do not have to. And Tara answered there in the chat as well.
Perfect. And then additionally, Sarah has asked, are there identified barriers from families to applying for ERDC?
Yes, I think so. I think, and feel free, anyone else on the call who's presenting to chime in on here, but I think a lot of families don't know about ERDC to begin with. And I think that's one area where we're really trying to expand outreach. I mean, we already talked about how we only serve 16% of eligible families, or families who could be eligible. And so that's something that is really stunning when you think about how many families could benefit from these services potentially if they knew about it. So I think that's one area, but there's also, I think in the past, there have been just areas where families might be more hesitant to apply. I think we've talked about the copay structure and how that's been restructured now. In the past, if families had higher incomes, a lot of times their copay would cover the cost of care or the cost of what the state would pay, that is. And so there wouldn't be a state payment being made out on their behalf. So then the benefit really became not very useful to them. And therefore, applying for ERDC or reapplying at recertification became less ideal and relevant to their situations. I think there are many reasons why there are barriers, and that's just one of the things we're trying to address as we're forming DELC and bringing the program over with all other early childhood programs to expand access, awareness, and availability.
And if it's okay, the one thing I just want to add, I think, as we're becoming DELC, I think we both have an obligation and an opportunity to really engage more deeply with families across the state to understand and hear directly from them on what are those barriers, or is it just they never heard of the program? Does it not meet their needs? So I think there's also an opportunity to deepen our opportunities to really hear directly from families on what those barriers might be.
perhaps a segue into our anticipated future changes. Currently right now as well, families can't both be on TANF and ERDC at the same time. And that is something that we're actively working on removing, that prohibition of sort of dual enrollment for those two benefits programs. So Jordan, I'll hand it back over to you to talk through what changes to ERDC are coming up.
Yeah, definitely. So Kayla already touched on one that's in the center of that right box there, which is what we're calling categorical eligibility for TANF recipients. And that really allows families to receive both TANF and ERDC at once. So that alleviates that barrier that formerly existed where families might apply for TANF mid-certification and then lose their ERDC slot. So we're really trying to continue that eligibility in both programs. Additionally, anticipated future changes are a reduction in the number of reasons a case will be closed mid-certification. And so the hope there is that we would actually have a truer 12-month eligibility period and more stability for families and providers. So there is a whole myriad of reasons why cases close right now, but we'll really be lowering that to just if families move out of state, if families request their benefits to be closed, or if they earn over the ongoing and exit income limits. And then lastly, in our anticipated future changes and things that we're working toward is eligibility for all children, regardless of their immigration or citizenship status. And we'll have more information around any of these anticipated future changes as well next week. We're going to be talking a lot more at length around future state policy for ERDC and what that looks like, and more specifically policy making and the opportunity for external engagement from community partners. And Dana, I do see your question in the chat there around the last one with income within the 12 months. Yes, that is a federal requirement that families do not earn over 85% of the state median income.
I'm sorry. I have a question about, it wasn't very clear for me about the immigration status. Would you please repeat that information?
Yeah, definitely. So through House Bill 3073, one of the charges that it gave to DELC is to approve eligibility for children regardless of their immigration or citizenship status. Right now, families do have to meet, or children that are in care do have to meet certain citizenship or immigration status requirements. But that's something that we're working to remove as a barrier, future state. That will require systems changes. So that work is being headed in that direction. We don't have too many details other than that.
Oh, okay. Yeah, I was just having that question because I received a phone call from a family, and I think the baby was born in Mexico and they came here legally. So they were really, really struggling with finding childcare because, you know, that's why I'm interested in knowing a little bit more about this. So is there a possibility that he can apply or they can apply for ERDC?
I would never say that anyone should not apply because there are a robust, level of citizenship statuses and qualifiers that might make them eligible right now. But what I would say is that in the future, once that policy is implemented, that would no longer be a barrier. Citizenship status, immigration status, that wouldn't be like an eligibility criteria factor for children any longer.
Awesome. Thank you very much.
Oh, go ahead, David. Sorry.
I was just going to say, while we don't have a date for when that will be implemented, we do anticipate that will be at least a year out at this point. So I just didn't want to, we are working towards it, but I didn't want to create too immediate expectations for when we're going to be able to implement that, unfortunately. So I just wanted to be honest about the timeline around that.
Yeah, and in that vein, Jordan made mention of systems changes being required. I think that this is just a good opportunity to sort of orient everyone to the fact that applications for ERDC go through the one eligibility system over at ODHS. And so when she was mentioning systems changes, ERDC will stay a part of the one eligibility system. And so any policy changes that are that we're sort of anticipating making or looking to make in the future, we do have to sort of make sure that we're updating the one system appropriately, and that, to David's point, has a little bit of lead time and planning around it. But that is the system she was referencing, the one eligibility system.
Yes, thank you for clarifying that.
Couple more questions in the chat. Any proposed changes that affect foster and resource family eligibility? What about those that might be over income but are hosting children in foster care?
Yeah, at this time, and David, feel free to step in if you would like to. But at this time, there aren't any plans to expand that eligibility for those families yet. But that has been something there have been conversations around. So as Kayla mentioned, everything requires, budget, system impacts, and lots of planning in that regard. But we have heard concern in that area. And I believe that there is some legislation actually that's been proposed to potentially expand eligibility for those families.
Yeah, and Representative Crop has introduced House Bill 2683 that basically does that. So still early in the session. So, but if you're interested in that, I would follow that bill.
I think Dana, Jordan, answer your question. The over income within 12 months, is that a federal requirement? Yes. Faye, to answer, I think, your question. So billing is coming through the mail. Will you have an online system in the future? Yes, with a heavy emphasis of in the future. During the transition and, in the, at least next couple of years, we anticipate keeping everything the same with the way vouchers, billing, and payment is being made. We know that, systems are often clunky, and we're doing our best to figure them out and sticking with like the very great partnership that we have with the ODHS systems teams that support that billing process right now. We are internally trying to build up the capacity to do all of that in-house at DELC, but that is, like I said, very heavily in the future. So for now, everything will stay the same. And I'll touch on this a little bit later in the last half of the presentation related to like, what does it mean operationally that ERDC is coming to DELC? Okay, Jordan, just to keep us moving, because I'm cognizant of time at 7:42, let's talk about providers, and then we'll get into that more operations focused piece of the pie.
Definitely. Yeah, so this is just a quick glance at who can be an ERDC provider. As you can see here, we've got a handy little graphic that goes through everything here in purple, includes those who are licensed providers, because ERDC providers can be either licensed or, in the teal here, license exempt. Either way, they just need to be approved and listed with the direct pay unit in order to receive payment. One just little call out we wanted to make, because a lot of families sometimes don't know that this is something that they have as an option, is that family, friend, and neighbor providers, or FFN, sometimes affectionately called, continue to serve a significant portion of ERDC families. And you can see there, those are those license exempt non-relative or regulated subsidy providers, or license exempt relative providers. Sometimes they're also called in-home if they're license exempt as well. So essentially, everyone can become an ERDC provider, or at least most can, and there's plenty of options for parents so long as they're able to be listed and approved with DPU.
Okay. Last, I think, question maybe on eligibility in the chat. With the new changes to the provider listing process, including the CBR requirements and the FFL training, has ODHS seen a decrease in the number of license exempt childcare provider applications this year? And what is the current timeline for an FFN provider to get approved? And I'm guessing that's probably of like, what's the average time it takes to get an approval?
Yeah, and I think that for that, we'll probably want to connect with the people who are working on that work offline and get back to you.
Okay, so we'll take those as follow-ups, and
Yeah.
in the next meeting, we'll put a sort of like follow-up questions and answers from last time and make sure we're bringing that back. So Nancy, we'll see you next week. Great questions. Okay, are there any other questions, comments, concerns about the ERDC program generally? We're going to move into what does it mean that it's moving over to DELC. So I wanted to make sure that if anyone had any outstanding questions about the program itself and the parameters, et cetera, we're answering those for you now or following up on those now. David, anything to add about the program before we move into migration?
Nothing from me.
Lovely. Let's do it. Let's rock and roll. It's going to be 5 o'clock here soon. What does it mean that ERDC will be at DELC? So I want to so heavily emphasize so as perhaps to bore you with it next time when you return. The main priority, like the strongest focus for both ODHS and ELD, coming all the way from the top at the leadership level, is continuity of service for families and providers during the transition. We don't want a single day to go by where a family can't apply for or access ERDC benefits. We do not want to run into a situation where billing forms aren't processed and payments don't go out for providers because the program moved from one agency to the next. To facilitate a seamless transition, we're trying to keep as many external connection points as possible, whether it's families, providers, community partners, the same. So we're trying to limit the amount of external connection points that people have to interact with differently. For families, this means they're going to continue applying through those sort of designated one system spaces, whether it's through the eligibility field offices, whether it's just online through the centralized application, whether it's through the virtual sort of call centers that facilitate application intake processing. All of that is remaining the same. All of that will continue to live as sort of a part of the Oregon eligibility partnership work. None of that will be coming over to DELC. There will not be a separate door for ERDC over at DELC. So everything for families to access the program remains the same. And should they have questions once they're approved and connected to a provider about any of their hours or the billing forms that went out, et cetera, they'll continue to contact DPU. The only difference is that DPU will be under DELC. It's not going to be under ODHS. So we're anticipating very little change for families from the status quo. For providers, same thing. They're going to continue connecting with direct pay unit. It's going to be under DELC, but that's it. If they need to connect with other units within ODHS, for instance, perhaps maybe they need to discuss an overpayment that may have been flagged and needs further investigation. Those shared services that ODHS currently supports will remain the same connection points. So any sort of outside the normal day-to-day billing, payment, DPU-centered questions that are fielded through ODHS shared services, and we'll go through them in a little bit more detail here in a couple more slides, those access points are going to remain the same. Nothing is coming in-house to DELC where they'd have to transition to a sort of new space, new connection point. And I can't emphasize this enough. The way that payments are going to be sort of cut and sent out and received by providers staying the same. We're going to continue to use the same systems over at ODHS in the short term until we can stand up our own infrastructure in-house at DELC. That's part of the larger provider management platform work that's being scoped out and looking to be implemented over the next couple of years, where to someone's very great comment, if it's sort of paper processing now, can we move it online? We're working towards that goal, but there's a lot of technical infrastructure and planning and sort of process refinement that needs to happen in the interim. So for now, to preserve that continuity of service, we're staying, in the most sincere way, the same as what happens now for providers. Community partners, similarly, are going to continue to connect with the child care policy unit when they need to, especially I think around like access to the one system, et cetera, and filling out those types of forms. There might be a slight process change as we bridge connections with making sure people have the appropriate access into the one system. That happens over at ODHS. The child care policy unit will be over at DELC. And so there's a little bit of a bridge that we have to connect for those two partners. But we're going to be staying the same for our community partners as well in terms of access. So this slide is a big status quo. We're trying to preserve it. Any questions on sort of connection points, what it means for families, providers, et cetera? Jordan, I didn't know if anything popped into the chat. I feel like I have a little bit of the less fun. What is ERDC? Or like
there hasn't been anything in the chat just yet.
Great. I'll keep going then.
Great.
Okay. So just, I think, another click into how families and providers are going to access ERDC once it moves to DELC. Like I said, it's the same. The family's going to apply via the one system or in a storefront office or through the virtual eligibility centers, right? They'll report if approved, once approved and through the application process, which is remaining the same. They're going to report their chosen childcare provider to DPU, and DPU is either going to say, great, they're already a listed provider, or they're going to say, nope, we got to get them listed. And that can also be done through an eligibility worker. Then the same billing form practice is going to be employed. So those billing forms are going to be sent to the family's chosen childcare provider. And then the provider will send it right back to DPU, just like they do today. And then payment will be made as appropriate for the specific billing form. Jordan, anything you want to add or you feel like needs a little bit more of a touch point?
I don't think so. I think that you covered everything there. One thing I did just want to overall let people know is that these slides will be available in video format on our website. We might also be able just to post the PDF. I think would also be helpful for people who don't have video access. But if you need to go back and look at them or you want to look at them, we'll have this available for those who weren't able to attend.
I think that's a great call out. We should have done that at the beginning. We'll do it at the beginning next time. So just a sort of another, I'm just going to keep going until someone stops me. And please stop me if you have questions. I'm very happy to field them. Just another deeper dive on preserving the status quo, the sort of the pathways from front door to, your 12-month certification needing to be renewed, staying the same. The family who needs childcare is going to connect with ODHS. They're going to initiate that application process. They're going to do their interview. They're going to get a decision notice saying, great, you've been approved. And then they're going to select a provider. Private provider is either learning about ERDC or says, great, I'm already serving ERDC families. Let's serve more, right? They either go through the listing process or they don't. The family lets ODHS/DPU, so ODHS being eligibility worker or DPU being DELC, right? Know that, yep, I'm connected with a provider, coordinate care. We move into the billing process. Family is receiving care. 12 months go by and it sort of happens again. Everything is staying the same with the small caveat here being that DPU is going to exist within DELC. And now I see questions in the chat, Jordan. There must be some I see.
Yeah. There are two. Nancy asks, will the ODHS orientation training for listed providers remain with CCR&R?
Yes. As far as I know, there is no anticipated change to that.
That is also my understanding. And then I think it's Tanya. I apologize if I mispronounced your name as well. But they ask, will the training materials for ODHS subsidy change with this move? And I think that's a really great question. Kayla, do you want to speak to that? Or do you want me to?
Can you just say a little bit more, or if you feel like you can answer? I'm just trying to read the question.
Yeah, I think it's getting at training materials for how eligibility is determined is what I'm gathering.
Yeah. Is it Tanya? Are we saying your name correctly? Apologies if we're not.
Clarify.
Yeah, that would be helpful. I
Okay.
just want to make sure we're answering your question instead of giving you an answer to what we think your question is.
No, it's totally okay. So when we provide the Part 2 training for listed providers or soon to be listed providers,
Mhm.
we obviously have our presentation that we present. We give them all the information, but normally we would talk about all of the programs and all of the resources that they have available to them, and ELD being one of them.
Yeah.
As far as that, I mean, would that change? I mean, we still going to say, okay, well, you can go to visit ELD for this, but yeah, I'm just kind of confused on what that would look like if we need to change some of our wording, I guess.
Yeah.
That wasn't really clarifying, but
No, I think that's helpful. I mean, I think you're calling out something great, which is, okay, we have a lot of work to do internally to make sure that we're having a successful migration, but where do we need to connect with our external partners who are also like a big part of this system? I do think that there's going to need to be a refresh, certainly, of some of those materials that represent the newer state of the world. I can go back and talk with Joanne Lindorfer about, what's the plan to look at those materials and get a fresh take. And we can put a little bit more of, I think, a structure around what that might look like next information session. But I think the short answer to your question is yes, there's going to need to be a little bit of a reframing effort. Jordan, do you want to augment or?
Yeah, I mean, I think as much as what can remain the same will in terms of like professional supports for providers. So things like ORO, partners through Portland State University, through Western Oregon University. I think all of that is set at this point to remain the same. It's really going to be shifts in branding a lot, I think. So ELD obviously will become DELC. So that will hopefully be useful, especially with, the direct pay unit being a part of DELC as well. It's kind of all going to be in one place versus, different locations in that way. But like Kayla said, I think that's a great question, and we'll go ahead and compile and make sure we're answering hopefully more fully for next session.
Okay, perfect. Thank you. And yes, you said my name perfectly.
Oh, good. Good. That's the trickiest part of public meetings, right? It's like butchering people's names and feeling terrible about it and have no way to sort of avoid it. Okay. Yes. The thing I was thinking about, Jordan, just to put a little bit more clarity out there for folks, it's like, I imagine that there's some sort of contact information, and I'll get into this in a couple of slides. And while the majority of contact information is staying the same, we are going to be switching emails and we are going to be switching websites for some things. And I think that's going to be important to make sure that we're all aligning on. Is there another? Oh, sorry, I talked over someone.
That was just me. I just said you're absolutely right. And everything in the chat so far is just thanking Tanya for her question. So you're good
Excellent.
to go.
Tanya, you're the star of the show. Okay. What about migrating units? So as I talked about a little bit at the beginning, like what is DELC? what does it mean to stand up DELC? We are inheriting some teams, some really, really, really fabulous teams over at ODHS as a part of DELC. So the childcare policy team, who's really the master of developing and administering the childcare programs, ERDC being the sort of primary one, and coordinates with other state staff inside and outside of ODHS to make sure that, families are able to access care, that the program is reflecting the state's policy initiatives and the way the administration is moving, and also reflects the appropriate amount of federal policy that needs to be taken into consideration. They're also, I think, the major connection point for community partners, and they're going to remain so in all of the ways that they currently are today. DPU, direct pay unit, which I think everyone has pretty clear line of sight on, will also be coming to DELC, like we talked about before. Their sort of main roles are making sure that providers become approved to receive childcare subsidy payments, and they, deliver on customer service needs to providers and families who are receiving childcare benefits. And then third, which currently folks might see as a team within a team, but they are sort of their own little unit, is the subsidy suspensions team. And they're really focused on making sure that the state is working through and analyzing any complaints or compliance matters as it relates to listed providers. So those three teams are going to be on July 1, moving from ODHS over to DELC, and they will be a part of the new organizational structure for the department. Are there any questions about those teams, what they do, why they're coming to DELC, how to connect with them, which we'll get into a little bit? Hearing none. David, you don't have any questions for me? You don't want to throw me a curveball? We'll get into the very robust summary of teams that support ERDC, who are going to continue supporting ERDC after July 1. So inside ELD and DELC, well, ELD and then DELC, not ELD and DELC at the same time. But, we have connections with 211 that will stay. ODHS also has connections with 211, and we're making sure that we sort out the appropriate relationships and how to keep that very important work going past the transition. The Inclusive Partners team has already migrated to ELD from ODHS and will continue doing the very good work of sort of connecting folks who need additional assistance or a level of care for their children, to connecting to the right spaces within both the state and the actual provider environment. Jordan talked a little bit about ORO, the Oregon Registry Online, and the Research Institute. All of those connections will be preserved. The early learning hubs and the CCRNRs are very great partners. All of those will continue to support ERDC even after it moves over to DELC, much in the same way that they do today. Obviously, the Office of Childcare has a big hand in the childcare system generally. And some internal teams to DELC, some really sort of organizationally focused teams, will be the policy and research team, which David is the chief of, the legal affairs team, the comms team, and then childcare policy, the subsidy suspensions team, and DPU themselves. So all of those sort of units or contracts or partners will sort of be the primary places where ELD/DELC is really going to work actively and have relationships with parties to support ERDC post July 1. Outside of that, and sort of still within the ODHS space, much of the administration of ERDC will remain in some of these units you see here under the ODHS Shared Services, ODHS/OHA column. So fraud and investigation unit, quality control, Office of Financial Services. There are a lot of really important shared services divisions that provide support to more than just ERDC, to a number of self-sufficiency and medical programs across ODHS and OHA who already have the internal capacity, the technological infrastructure, the processes, and the connections to other parts of state government or external partners that ODHS and OHA have already leveraged to support the very large number of programs within the one system. As ERDC is going to be remaining a part of the one system, and eligibility will be continued to be processed through the the organ eligibility partnership, effort, it makes a lot of sense to continue leveraging the sort of economies of scale within ODHS and OHA in these shared service divisions. And so we'll be continuing to have a very close partnership with ODHS and OHA to support ERDC through these various units when parts of the program sort of are impacted in these ways. Also, we have some additional external partners outside of just ODHS, OHA, and DELC. The Department of Justice is, very key to providing good legal support to the program. Department of Revenue, also very key in terms of working with ODHS and OHA for any overpayments or corrections that need to be processed. Obviously, the unions, SEIU and AFSCME, are a very important partner to making sure that we're successful in building our childcare supply. And there are some federal partners as well. We've named USDA, but I think really maybe our CCDF partners at the federal level are a sort of huge connection that will be preserved and retained much in the same way that it exists today. I see a lot of questions in the chat now, Jordan, so help me out and let's see what I missed.
Nope, you actually don't see any. I just forgot to plug in a link that I mentioned that I would plug into the chat earlier. So that's just me. There's actually no questions, but I wonder if there are any, if anyone has any now.
And you guys did get a shout out for this slide. It was appreciated.
Oh, good. I apologize that it sort of looks like a laundry list, but I do think it's important to see that this program, really, a lot of it will still continue to be supported and administered throughout the state agencies, not just solely in DELC. And I do think that's a really important call out. And it's going to require a lot of partnership and coordination between all three agencies moving forward. And so we're really hopeful that we can be as transparent about that as possible and letting you know where sort of we have administrative responsibilities and where we're sharing those administrative responsibilities with other partners. Okay. I'm going to keep us going. So just a little bit on the high level of, okay, well, you've showed us this laundry list. How are you guys going to work together to actually administer the program? So today, the feds say, here are our broad parameters for ERDC. Here's the money that's attached to those parameters. ELD takes that in, as will future DELC. And as the lead CCDF agency, we sort of set the high-level guidelines for using those federal funds. The federal funds are transferred over to ODHS today, and ODHS administers the program, as I like to say, soup to nuts. So they set the policy, they're making eligibility determinations, they're modifying programmatic operations as they see fit on the day-to-day. The new way it will work post July 1 is the federal government will remain the same. We will, as the lead CCDF agency, continue to be responsible for that coordination and compliance with the federal government. But in addition, we will be the policy-making arm of ERDC. We will say that, this is where the program is going in terms of eligibility, provider requirements, rate scheduling, et cetera, et cetera. And then the implementation of that policy that we're setting will be shared between ODHS and DELC through the sort of various units that I outlined in the slide before and the responsibilities that are sort of core to their mission. Jordan, is that still you in the chat, or have I piqued someone's interest with a question?
Dana just mentioned that that was a lot of partnerships on the previous slide, and I just told her it definitely is.
It very much is. Okay. What is changing? Because I think this is the only question here, right? Like we've said everything's staying the same, but certainly that can't be true. Something must change, which is true in some small pockets. So operationally, very little will be changing. Like I said, we've really, really prioritized continuity of service. However, in the short term, some things to note, and this will not be the only time we share this information, by the way. There will be a whole communications plan around making sure people know what is changing and where to access information and what email address to use. But just in the short term, want to throw out some very high level sort of changes. Email addresses for the direct pay unit, the child care policy team, and the subsidy suspensions team will change to DELC's ending address. So, all of the saved DPU, jobs, payments, emails, or the child care policy question box, all of those emails are going to have to change over. And so we just want to flag that now because we know we live in a predominantly digital world now, especially after these last couple of years. And so just want to flag that's going to be a big change, and making sure that we're being thoughtful about how to roll that out is going to be important. On the other hand, we're not expecting phone numbers or where DPU's PO box address currently locates to change at all. We're expecting all phone numbers and the DPU PO box address to remain the same. So hopefully that will provide a little bit of logistical certainty on those areas. Access to the one system or other sort of technological infrastructure for community partners. There's still going to need to be an access request made through ODHS. We're working out with ODHS what, if any, changes to that process will need to be made. But we do know that that's a big connection point for our external partners. And so we're just trying to make sure that we're flagging now. As the child care policy team moves to DELC, they'll sort of be one step removed from where they currently can make access requests in ODHS. And so we're just flagging early that there might be a slight addition to any access request process that rolls out, but we're not expecting any major changes. They'll still be going through ODHS, as ODHS will still be the sort of gatekeeper of all of the systems supporting ERDC. And then just a last flag on a change is we do expect to be doing our own data reporting for ERDC. So whereas before there are some numbers reported out by ODHS, we're starting to actively work on, what does data reporting look like? What does it mean to be good stewards of ERDC data? How do we make sure we're creating smart metrics and looking at what we should be forecasting? We don't have an exact timeline for when that data reporting would start to roll out and be consistent, but it's something we're looking at, and it will happen, I would say in the coming months after the transition. Those are operationally the sort of key changes that I wanted to flag. Policy-wise, like I mentioned a couple slides ago, DELC and the Early Learning Council are going to be the policy-making arm for ERDC. What that means in terms of process changes, how to engage, what a rule change process would look like, how sort of feedback is incorporated and included in the policy-making process is a subject that we're going to dive really deeply into next week. As I mentioned earlier, ERDC is a part of the One System, and the One System is a very sort of technical program in terms of the IT systems that support it. And so knowing that we're staying attached to the One System and the processes that are associated with effectuating policy changes in the One System, we want to be really thoughtful and intentional about when to engage folks on ERDC policy changes and when's the right time, and how do we make sure we're doing that in a very meaningful and thoughtful way. So we're going to make that a sort of the large segment of next week's conversation, and that will lead into the rulemaking advisory committees that I previewed at the very beginning. In the long run, I think, as someone has brought up in the chat, we do expect to stand up our own provider management platform. So we do expect to sort of bring in-house the billing, the voucher, all of the things around processing payment on the provider side. But we're still very actively building out what that would look like. What's the scope that we think we can execute on really well? And then we'll get into what sort of timeline is associated with that and when can we start talking about a changeover. That's not expected in the near term, as far as I know. So that is, I think, the end of our presentation for today. Next week, like I said, we're going to talk about what partner engagement will look like for policy and programmatic changes with ERDC coming to DELC. We have, I think, a very great engagement process for rule changes now at the Early Learning Division. We're really excited and want to be really intentional about our sort of engagement processes around rulemaking and policy changes. It's going to need to look a little bit different for ERDC than it does for other programs that ELD currently has, related to those systems pieces I was talking through before. And so we want to make sure that not only are we bringing something to the table that we think works, but that we're getting feedback from the community on, does this process for policy making make sense? So with that, I think I'm going to open it up for questions, comments, concerns about today's presentation, about what's coming next week. And Jordan, if you want to add anything.
I was just going to touch on some of the stuff in the chat right now. It looks like one of them, Chris already jumped in and answered. Thank you so much, Chris. And that was an answer to Nancy's question, which is, will the current provider data that CCRNRs receive have a stopgap during this transition? And the answer to that is that CCRNRs will still receive monthly provider data reports. There won't be a stopgap. We want to make sure that there is as much continuity for providers, parents, and partners as possible. Additionally, there's another question here from Tanya again that says, is there a timeline when families and providers will be made aware of these changes? I know we've already started kind of communicating out to families and providers around kind of the overall transition, but Kayla, do you have any other specifics kind of around a specific timeline with our communications teams?
I certainly don't want to speak on behalf of Marion, and so let's take that back. I don't want to get out in front, but yes, there's sort of an active comms plan being generated around what's appropriate, how many banners do we need to put up on the website, you know, like, are we doing flyer? Like there's definitely conversations happening. We'll take that back and get a little bit firmer next go around. I think I also saw another question, Jordan, in the chat is a little bit further up. New email addresses will be sent out, right? Will you have it on the next meeting? Won't have it for the next meeting, but yes, as a part of the comms plan, a sort of update for how to get new contact information for all of the units. That will be part of that. I do not anticipate that will be sent out too far in advance of the transition. And I think the major concern there is having competing inboxes that sort of need to be managed simultaneously instead of thinking about a shorter, tight, well-executed transition. So not for next time, but those will definitely be shared with partners and the public. Did we miss any questions in the chat?
I'm looking, I'm not seeing any that we haven't already addressed, but I'm kind of scrolling up.
Okay. We're at 5:18. Apologize for running over our hour allotment. I mean, I'm happy. Oh, all right. I'm happy to stay if anyone has questions, but you know, happy to let folks go. Enjoy Thursday night.
Thank you so much. All of this will be made available on our website, and I also put a link in the chat for next week. Thank you guys.
Everybody. Thank you so much.